Let's review valvular heart disease. I know it can be intimidating, confusing, but I'm going to make it easy, straightforward, and give you key concepts to remember. It's a mnemonic, easy way to remember every valvular heart disease, what kind of murmur they're going to have, where it's located. Stick around and let's get something done. This is the first question. It's based on valvular heart disease, right? But don't worry, there will be a bunch of words in it. The first one is very important. You have to understand the question. Which assessment finding is most? So we're looking for most consistent with that, most concerning and require immediate notification to the healthcare provider. That means something bad. So this is prioritization 101. What is the question? And this is caring for a client with what chronic mitral valve regurgitation. Therefore, we have mitral valve regurgitation. Always, they will give you the name of the valve, and you have to figure out what to do with it. It's chronic, right? Mitral valve regurgitation. Which assessment finding is very concerning or require immediate notification to the healthcare provider? The first thing you have to know, you have to know something about the valve. If I draw the heart like that, this is your right side, this is your left side. The mitral valve separate the left atrium from the left ventricle. That's the first thing. Know the location of the valve. Then the second thing you're supposed to know is what happened when the valve is leaking or a stenosis, right? Valvular regurgitation means it's leaking. Then stenosis means it's stiff. Blood does not cannot pass through it. In any case, when there is leakiness or stenosis, think about it as if blood is backing off to the any structure that is behind the valve. Therefore, if here blood is leaking, some of it will go into the left ventricle, and most of them will go back into the lung because that's where the blood is coming from. Therefore, most of the symptoms associated with the mitral valve regurgitation is going to be what? The pulmonary symptoms. That's all. Blood is backing up. So think about it. At least it's going to have left-sided heart failure and pulmonary congestion. That's all. That's the first thing. Then if you want to know where is the murmur located, whether it's a systolic or diastolic, there's a mnemonic for that, right? So let's get to it. Fatigue and exertional dyspnea. This is what? I have fatigue, exertional dyspnea is consistent with the chronic condition, right? Because of less blood flow. This is all an expected finding for regurgitation. So you have exertional dyspnea. When you try to exert yourself, you have shortness of breath. Systolic murmur at best at the apex. Ask yourself, does mitral valve regurg causes a systolic murmur? And the best way to remember this is what? I call it MRAS-MVP, right? Which is Mr. AS MVP are usually systolic. They play systolic. So mitral regurgitation, aortic stenosis, mitral valve prolapse, okay, they causes systolic murmur, right? That is the thing. Then MS AR is what? Miss AR rest in diastole. That means mitral stenosis, aortic regurgitation, rest in diastole, right? Mitral valve regurgitation, which is what? Mitral regurgitation will lead to a systolic murmur, right? Is this concerning? It's an expected finding. That's all. Freckles in the bilateral lung fields, hey, heart failure. If I'm having lung symptoms, that is now it's an acute problem. Freckles in the lung fields, now blood has back up and I'm having left-sided heart failure leading to pulmonary congestion. You see it? Palpitation in occasional skip beats is an expected finding in a mitral valve regurg. Therefore, which finding should the nurse report to the healthcare provider? Lung symptoms, pulmonary congestion. This is worsening. The condition is worsening. 1, 2, and 4 are expected. Number 3 is getting worse. We have a worsening situation where the mitral valve regurgitation is leading to heart failure. This is the way to master this kind of content. Once again, the mnemonic, how do you know this? Which one is systolic? Which one is diastolic? Is what? MSAR, what? Rest in diastole. Mitral stenosis, aortic regurg, rest in diastole. But what? Mr. AS MVP, what? Play in systole. That means mitral regurg, aortic stenosis, mitral valve prolapse, they play in systole. Therefore, these valves problem are systolic, mitral stenosis, aortic regurgitation, diastolic. So we will see a question similar like that, and then you'll see what I mean by that. That's the first question. So 3 is the right answer. Second, a nurse is caring for a client with what? Aortic stenosis. Which assessment finding would the nurse suspect in the client? Same strategy. Don't worry. Let's get to it. Let's draw the diagram. Aortic stenosis, the aorta is taking blood from the ventricle to the rest of the body. So this is the aorta taking blood to the systemic circulation, right? If you have stenosis, blood is backing up to the left ventricle. That's all. There's not going to be enough blood. There's less blood going to the system. Therefore, if I check your pulse, are you going to have bounding peripheral pulses? No, your pulses is going to get weak because there is less blood passing through the aorta, which is stenosed. So less blood getting into your system. This is wrong. Syncope on exertion. This is what kills people with aortic stenosis, playing basketball, football. They're running and all of a sudden death, heart death, right? They drop dead because they have stenosis. As soon as they exert themselves, less blood is passing through the aorta, and therefore the blood pressure drop. The systolic and diastolic become the same. You have narrow pulse pressure, and they fall down and they die. Therefore, syncope and exertion is right. Narrow pulse pressure, I've explained it. As the blood passes through the aorta because of stenosis, your systolic blood pressure is almost the same as the diastolic blood pressure, like you have tamponade. So they have usually narrow pulse pressure, which can lead to sudden heart death, right? They can drop dead. Therefore, this is suspected. Systolic murmur head at the right sternal border. You already know this. I don't have to, I was explaining to you. If this is your heart, your chest wall, you know the aortic murmur is on the aortic valve is on the right side. The pulmonic valve is on the left side. Then Ebb's point is also on the left side, tricuspid and mitral valve, right? These are second intercostal space. This is the third intercostal space, tricuspid, fourth and fifth, and mitral valve, fifth on the left side. The aortic murmur is on the right side. Therefore, systolic murmur on the right side, this is a classic. Shortness of breath with activity. Yes, when you try to exert yourself, you have shortness of breath. Bradycardia with irregular rhythm, that is not true. Aortic murmur does not cause bradycardia. It causes arrhythmia. Therefore, this is wrong. So 2, 3, 4, and 5 are right. So think about it. Most of these questions are straightforward. It requires some content related, but you need to draw the diagram, draw the picture, use the location of the valve, and you'll be able to figure out. So I'm explaining why each answer choice is wrong. This is the same thing. We talk about it. A nurse is assessing a client with suspected mitral valve stenosis. Which of the following findings should the nurse report to the healthcare provider as most consistent with the condition? Sit back. Don't answer the question. test-taking strategy. Go for the buzzword. The buzzwords are things that will basically should be ringing in your ear. You focus on them, not all the 3 lines I've given you. Let's look for the buzzword. One is consistent, but it has to be most, right? And what are we talking about? Mitral valve stenosis. Then if I draw my diagram, I have what? Mitral valve stenosis, most consistent. Rewrite the question in your own words. That means I have mitral valve stenosis, which finding is consistent or associated with mitral valve stenosis. I know the mitral valve is on the right side. No, the left. I know the mitral valve is on the left side between what? The left atrium and left ventricle. And if I have stenosis, that means blood is not going to the left ventricle. Where would it go? It goes back to the lung. Therefore, I'm looking for left-sided heart failure, right? Left-sided symptoms. But then, what are they asking me? Bounding peripheral pulses and wide pulse pressure, right? Low pitch diastolic murmur head at the apex. Systolic click head best at the left sternum border. Loud S1 followed by a normal S2 without a murmur. That's taking strategy. I know there's a bunch of big words there. They're very confusing. They're very intimidating. Step back and look at it carefully. Look at number 4. A loud S1 followed by a normal S2 without a murmur. They're talking about what? Mitral stenosis. You know it's supposed to give you a heart murmur. Therefore, I'm taking 3 out, 4 out right now because he said without a murmur. Now, we talk about it. I told you MR, that is Mr. ASMVP. What is he going to do? You rest in systole. Then we have Miss AR, who what? Rest in diastole. So Mr. AS MVP play in systole and Miss AR rest in diastole. What is that? Mitral valve stenosis is this. Mitral valve stenosis supposed to have a diastole, what? Heart murmur. And I see diastole, I may take it. Systolic click, I don't know what this means. Test-taking strategy, common sense, right? Best head at the left sternum border. I don't know what it means, but I know based on my mnemonic, mitral stenosis is supposed to give you what? Diastolic heart murmur. I see a systolic, I'm not picking it. And this will not play a role in your peripheral pulses anyway. Therefore, most of the time, a peripheral pulses and a wide pulse pressure, this is aortic regurgitation. Think about it. Aortic regurgitation means your blood get out of your heart and come back again. Therefore, the pulse pressures will be very high because your diastolic and systolic difference will change and your pulse will be bounding. Instead of aortic stenosis, your pulse is going to be weak. You see how each answer choice can be broken down even if it look intimidating. Number 3 is a systolic murmur. Number 4, I don't have heart murmur. I get rid of it. And these pulses are high with the wide pulse pressure. What I'm left with is the diastolic because I know Miss AR rest in diastole. That means mitral stenosis or aortic regurgitation. You have diastolic murmur. Number 2 is your right answer. Next question. And this is assessing a client to rule out mitral valve stenosis. We want to rule out the same thing. Which of the following client complaints should the nurse report to the air care provider as most consistent with this condition? I'm giving you a bunch of questions on mitral valve because that's the most common one you both loved. And by the answer choice are always straightforward because if you overthink it, you mix it. Same thing. We draw the heart and we know mitral valve is between the what? Left atrium and the left ventricle. If I have stenosis, I'm thinking about things going to the lung. Which of these is most consistent with this finding? I have noticed some mild swelling in my ankle by the evening. Think about it. If I have mitral stenosis and it's affecting me, I'm going to have left-sided heart failure, which is what? Pulmonary congestion. Therefore, I'm going to have only pulmonary symptoms. If I have leg problem and it's swelling, it's right-sided. Therefore, I ignore it. I'm not going to worry about it. Sometimes my heart skips a bit when I drink coffee. Well, you have palpitation from drinking caffeine. Get rid of it. I get winded just walking from my bed to the bathroom. Small exertion and you have shortness of breath. That is pulmonary edema. I have had occasional chest pain when I stress up, where stress-induced chest pain. What is your answer? It look intimidating, but you can see you get the answer straight by just knowing where the mitral valve is located, what happened to the mitral valve. Blood is going to back up into the lung. What kind of symptoms you should expect? Pulmonary congestion. Which of this indicate pulmonary congestion? I get winded just walking up from my bed to the bathroom. Number 3, your best answer choice. If these questions are hard, stop the video, answer it, and see the way I'm going to answer it. And if you have issues, I want you to put that in the comment. Which home instruction is most important for the nurse to reinforce? The easy way to answer questions. I usually don't look at the answers. I read the question, figure out if I understand it. They say the patient have a tricuspid stenosis. I know it's on the right side, right atrium and the right ventricle, and it's between here like that. That means if I have stenosis, blood cannot go into the right ventricle. Blood is going to the what? Circulatory system. So you have systemic congestion. It's like right-sided heart failure. Every teaching I'm going to provide to the patient, it has to be related to the right-sided heart failure. Avoid high sodium food. Well, you're going to have fluid retention. Is it not a good idea? Weigh yourself weekly. Should you weigh yourself weekly? Take potassium supplement with meal. Should you take potassium supplement with meal? No, the bad idea. Use ibuprofen instead of acetaminophen. Is it a good idea? Stop the video, put down your answer. What do you think? Give me your answer for number 5, and I will read the comment and see what you put down before I give you the answer. And if you get it wrong, don't worry, I got you. Explain it again. Right-sided, you have fluid congestion on the right side. Therefore, I need to get rid of fluid. Sodium, love fluid. I should avoid sodium. If I want to weigh myself to see if I'm gaining weight, it should be daily, not weekly. Do I need to take potassium because I have fluid overloaded? No, unless I'm taking diuretic. So that's a trap. If you take ibuprofen, it's going to retain fluid. You better take acetaminophen rather than ibuprofen. Therefore, number 1 is your right answer. You can see you got it. I know you got it because you watch adapting class. A client with stenosis is being assessed. Which finding is most consistent with the stenosis? Same strategy. I have not changed anything. I just draw my diagram. I know this ventricle and the pulmonary. This is your lung. That means blood cannot get into the lung. Therefore, blood stay in the right ventricle. That's the problem. If the blood is going to stay in the right ventricle, you're going to have right-sided heart failure. Talking about right-sided heart failure. Well, right upper quadrant pain is hepatomegaly, one of the signs and symptoms of right-sided heart failure. Therefore, if I see abdominal pain, it's consistent with hepatomegaly. Therefore, what is the right answer? Number 3 is the right answer. Like I said, these questions are difficult, but they are not because they are valvular heart disease. It requires some critical thinking. Think about it, test taking strategy for your nursing school or NCLEX or whatever exams you're taking, you'll be able to master it. Which of the following, if reported by the client with chronic aortic regurgitation, should prompt the nurse to notify the provider. Same thing. Don't worry about it. Figure out where the aortic valve is. As told you, the aortic valve is left ventricle pump blood through the aortic valve into the system. Therefore, if the aortic valve is in trouble, this one is regurgitation. So blood go back to the left ventricle and go into the system. And therefore, you have left-sided fluid overload. The same thing, right? So you can get right-sided, left-sided heart failure. It's a chronic condition. When you have chronic condition, there's a certain symptoms you should see. This is the way to answer questions related to heart valve problem. I expect certain symptoms, but if I start seeing new things or worsening of that symptoms, that's my priority. Headache in the morning is not related to this problem, right? But increased need for daytime naps may be related, right? This is all fluid overloaded, right? A new onset of atopnia and paroxysmal nocturnal dyspnea sound weird. That means when you lay flat, you're going to you start having shortness of breath at night, right? You can't lay flat, so you need a bunch of pillows. You had a mama at the left sternal border. I mean, is it not that's what you expect from aortic what? Regurgitation. So for 1 and 2 and 4 are something I expect. But 4 with the new problem, I can't even lay flat. And if I lay flat, I have shortness of breath at night. I'm worried about it. I'm worried about it. Remember, aortic regurgitation, why do you hear the murmur at the left sternal border? But you look at the aortic valve is on the right. But if I have regurgitation, I hear it here. Why? Because the blood from the aortic valve reflux to the ventricle. So it's the backward flow in the left ventricle, which is located on the left side. That's why you hear it at the left sternal border. It's very important you understand. The stenosis is on in the right place, second intercostal space on the right sternal border. But if I have regurgitation, the blood flushes back into the left ventricle, and therefore the backward flow of the blood is what the murmur is related to. Aortic regurgitation, so you hear it on the left side. 3 more. I'm picking your mind. A nurse is assessing a client with a no mitral valve stenosis. We're back to mitral valve stenosis. I know I've given you all variation of questions, so this one should be easy for you. Which client statement require immediate follow-up? Tell me what you think. Read the answer. Put down your answer choice and let me know. I get tired more easily lately. Sometimes I feel my heart flattering. I sleep with 2 pillows to help me breathe better. I've started coughing up pink, fruity mucus. You know the answer. You watch adapting, please. Put down your answer. I know you got it. What do you think? Mitral stenosis. We're talking about mitral valve stenosis. What will happen? Mitral valve stenosis, blood is going to back up into the what? The lung. I'm looking for pulmonary symptoms as my priority. I get tired more lately. What do you think? An expected finding. Sometimes I feel my heart fluttering because blood is backing up into the left atrium. You can have AFib from there. I sleep with 2 pillows to help me breathe because I'm having pulmonary edema, right? Autopnea, right? But look at it. When I start coughing up pink furious sputum, I have severe pulmonary edema. I'm drowning and I'm dying. What do you want to do? Number 4, need immediate intervention. You know it. If you know heart failure, you know these kind of questions. If you need more, check out that thinkers. I have a cardiology video on heart failure that will blow your mind, and you should check it out. A client with mitral valve stenosis called a clinic and report feeling increased what? Fatigue, shortness of breath, and racing heart. That is a problem, right? That is a problem. Stenosis with all these symptoms, it means bad heart failure and probably having pulmonary issue and the atrial fibrillation. What would you tell them? Those symptoms are expected, just rest more, try to relax and limit fluid intake, schedule a follow-up appointment for next week, or come into the clinic or go to the emergency room. Safety, safety, safety. This one, I put it there to let you know you're not going to get all the hard questions all the time. Something straightforward that you know. Patient is having problem. You can't solve it over the phone. Come in and we will fix it, or you go to the emergency room. Then the last one, prioritization, delegation. A nurse is caring for a client with mitral valve stenosis and activity intolerance. That means the stenosis is getting worse. That when they walk in, they have problem. What action will you delegate to the UAP? I always say UAP, you pick something that does not require thinking. And what is that? Nothing that requires thinking. If they're not supposed to be educating the patient. You're not supposed to be monitoring anything. You're not supposed to teaching anything. All they need to do is assist. Therefore, I look for the adjective about assisting for ADL. Educating the client about sodium restriction, negative. Monitoring for irregular heart rhythm during ambulation, no. Assisting the client to the bathroom using the gait belt, excellent. Teaching the client how to monitor pulse at home, negative. What is the right answer? Assist the client. Some questions on valvular heart disease, challenging, but not challenging. You require test-taking strategy, looking at each question, mastering it, paying attention to the buzzwords, picking the right answer using common sense. This is Adapting Class. If this video helped you, you can press the like button or put a comment to help us grow the channel. Share with your friends. But take care of yourself. If you need more, check out Adapting Class. We have membership that will help you pass whatever exams you're taking. But good luck, best of luck, and never stop charging. Keep charging as always. Bye.